Well, Jim, as some of my staff say, it's all about the data, and I think that's really true. I think we do a great job of collecting data, but we collect it in so many silos that it's tough to move around, and it's tough for our physicians to get a complete picture of what kind of care the patients received, what the patient's history is, et cetera. I think within the DoD network, we do a superb job of moving data around. We can have a serviceman seen at a clinic in Italy, 2 days later fly into Jacksonville or Bethesda, and all those records are there. So that's a great area of strength for us. When the service people go outside of our direct care network and they go into TRICARE and they see a commercial provider, we don't do such a good job. Right. It's tough to get that information back. I can tell you, we were talking about aging a little bit before the show.
You have to bring that up, Dave.
I've had a string of unfortunate medical incidents, and I've seen in the last 3 or 4 months, I've seen my GP, been seen by an orthopedic surgeon, and I've been seen by a gastroenterologist. They're all in the same campus, the same hospital.
But you filled the forms out every single time, I bet.
Exactly. Do you think that they can see, my information from each other's visits? And the answer is no. So certainly we're working much more aggressively to try to integrate all of that data. And so that we don't have the necessity of repeat tests when our members basically transition from provider to provider. I think Chuck talked about involving the patient more into care. You see a lot of areas there. And then the other thing we're very aggressively working on and have been in the military system is how do we detect and promulgate clinical best practices, whether it's a serviceman injured, out in the theater, or whether it's care of a serviceman's wife, OB, or something like that. We're constantly, and our docs are constantly looking at what sort of clinical results, what can we do to improve our clinical results, and what practices sort of contribute to that, and basically to find that out, again, it's all about the data.
Yeah, it really